Absolutely delighted now to be joined by Andrew Gennery. Andrew, welcome.
Thank you.
Thank you very much indeed for joining us today.
Thank you.
So let's kick off by looking at Paediatrics Day. So what are some of the bigger developments in paediatrics?
So Paediatrics Day is a great innovation which has been going 5 or 6 years now, and as paediatricians we look after different diseases, but many of the problems that we face are common to across the diseases. And I think some of the things that are happening at the moment, the big debate, if you like, is in graft manipulation for patients who don't have a matched donor, either a matched related or a matched unrelated donor. Then we need to choose a non-identical donor. And in paediatrics, often we're able to choose a parent who is a half match. And the risk of using a parent is that you produce graft versus host disease. And in trying to reduce graft versus host disease, you manipulate the graft and that leaves the patient at risk of infection. And so there's been an evolution over time of ways of improving those outcomes, both to reduce GVHD but to protect against infection. And the two methods that are current and which we're debating, which is the most effective, perhaps which is the best or which is the most appropriate in a particular situation, are the TCR alpha beta depletion, which is where we manipulate the graft, taking out the TCR alpha beta T cells, but leaving all the other cellular elements, which aids engraftment, prevents GVHD, but also helps fight infection. So that's a very exciting development. There's been some information available about that. And in parallel with that is a much cheaper and possibly as effective method, which is the post-transplant cyclophosphamide. So again, we use an unmatched donor or a half-matched donor. We give the whole marrow. And of course, there's a risk of graft versus host disease, but a couple of days after transplant, we give cyclophosphamide, and that gets rid of the GVHD-causing cells. That's a much cheaper method than the cell manipulation method. I think there are two methods that are changing the way we approach transplant. Certainly making transplant available to more patients, and we need to evaluate how each of those methods are doing, but also how they compare with each other.
Okay. Now last year when we met, we talked a little bit about gene therapy, and it was very novel with paediatrics. What have been some of the developments since then?
So the exciting thing last year was that for the first time we were getting a gene therapy vector licensed, and so we now have on the market a gene therapy which is licensed by the European Medical Agency. Now, in parallel with that, there are ongoing gene therapy trials for other forms of immune deficiency, and they've been going for some time. We're evaluating how those are working. And I would imagine within the next 5 years or so that some of those diseases are going to have a licensed gene therapy product available for treatment. I think what we're seeing is gene therapy moving from research to mainstream treatment, and it becomes part of our toolbox to treat patients with transplant, with some of the cell manipulations we were talking about, and gene therapy is part of that armamentarium.
So, I mean, you talked about a lot of new developments, a lot of research. How easy is it, or how do you go about making all that available to patients?
Yeah, so the important thing is communication. And Inborn Errors Working Party has a fantastic network. We meet 2 or 3 times a year and talk about cases, talk about the projects, talk about research. But we also have a very close email network. And so if I have a clinical problem, a patient I'm not sure what to do with, then I can email around that network and ask colleagues all around Europe and indeed all around the world, how do I approach treating this patient? And I will get sometimes many answers and many suggestions back, but that helps deliver information for that patient. But then on a wider scale, because we're working as a collegiate group, we're publishing our studies, we all become aware of the current treatments and we can take those back to our individual centres, and so that is impacting on patients around the world. And then we're busy making guidelines so that people maybe not even involved with the group can study the guidelines, and that will have a greater impact further.
Thank you very much indeed for sharing all that with us. Really appreciate it. Thank you.
Thank you.